Hi, today I'll be presenting to you the latest clinical trial on virtual reality exposure therapy as a treatment for social anxiety disorder. This latest clinical trial was conducted by the group of Stéphane Bouchard in Canada, where they compared this treatment using virtual reality together with cognitive behavior therapy against the gold standard, which is cognitive behavior therapy with in vivo exposure. First of all, let's explain what social anxiety disorder is. It's actually quite a debilitating disease or disorder whereby a patient is really afraid of negative evaluation. During performances such as presentation or social interactions where they're really concerned, and it actually sometimes leads to death, and it's very socially debilitating. Now, the issue that the scientists are trying to resolve is that while there is actually a proven treatment for social anxiety disorder, it still largely remains untreated. And why is this? It's because CBT with exposure therapy is actually very prone to avoidance. The patients themselves are afraid that, going to the therapists actually involves social interaction. They also lose privacy because the exposure, in such situations, they might meet people they know. And practically, the therapy actually requires them to be exposed to the stimulus that they fear. In addition to this, therapists find it very challenging to come up with the various situations that CBT require because it's really based on having the patient be exposed to the specific stimulus that's causing their fear. Additionally, CBT exposure therapy also requires homework for exposure therapy, which provides limitations for the therapist because they can't see it and therefore they can't supervise and rely on the patient to tell them what's going on. And so, virtual reality exposure therapy has seen this as an opportunity, and people are very curious about what this is. But before we go there, let's just ground ourselves with what exposure therapy is. It actually requires repeated confrontation of the feared stimuli, but in the absence of the feared outcome or the response. Okay, so this is actually equivalent to fear extinction, which is based on Pavlov's classical conditioning, in which the conditional stimulus CS that was previously paired with an aversive outcome or unconditional stimulus US is repeatedly presented without being followed by the US. So this whole extinction principle is actually, if you really think about it, quite threatening to someone with SAD. So what are the benefits that virtual reality poses, which addresses the limitations of the traditional therapies? First of all, it actually allows the therapists to present quite a wide range of exposure situations. And in this case of this study that I'm talking about, they were able to present 8 different scenarios, which the patients were able to pick and choose depending on what their anxiety was about. And the person can actually be repeatedly exposed to the stimulus without real fear. And that's really very helpful. It reduces the avoidance. And also because the therapy happens in the treatment room, the supervision by the therapist is actually there, and it allows it to be repeated everywhere else that's able to test the VRET procedures, expanding access. And so for this particular study, what did they seek to do? First of all, prove that it's effective as a gold standard. Not only that, it's effective versus control. It's obviously going to address the barriers of privacy and lowering the threshold with social interactions. And this is actually the first study that assessed patients' experience with a measure. And so what was the hypothesis? What they wanted to seek out to do was to check whether the therapies were equally good at improving the symptoms. They wanted to also assess therapists in the study, as I mentioned. What are the independent variables? It's different treatment approaches. And what are the dependent variables? These are the different measures that look at anxiety scale of the panelists, of the respondents, in this case, the patients. And also, they looked at the respondents, the therapists who shared whether it was practical or not, or more practical. They also wanted to check for side effects for the device, and also the presence, which is part of having a virtual reality treatment. And so this is a very quick summary of the fields that were put in place, right? As I said, there's the waitlist, the in vivo, where they had 1 hour weekly sessions of CBT, followed by exposure therapy, in vivo and in vitro. And so what are the results? The results were actually as expected in the hypothesis, whereby exposure to in vitro exposure therapy was actually equal and even better in certain cases. They were also able to measure 6 months post-follow-up, which addresses the effectiveness too. And the therapists really found it much more practical. And so this is really groundbreaking. However, there remains effectiveness. Not all patients benefit from CBTET, and not all exposure is able to provide all kinds of stimuli. And so with this, there's still a whole lot of opportunity for future research to find out how this can be improved. Why? There's so much more cultural differences in SAD. Now, with many more migrants, there are more situations that come, and social media is adding new stimulus. Therefore, there's a need for wider access to such an effective therapy, and virtual reality can also be used to train a lot of people. And so with this, while this is a groundbreaking study, there's a lot more to be done and a lot more repetition in all these different cultures and situations, but it's truly as promising in that they're able to compare 2 different treatment exposure types with placebo, and the results are very, very good. Thank you very much.